Now it's time for our mycology section. I'd like to start it off with a little joke about a fungi. Damn it, that was the punchline. Never mind. There aren't that many of these guys, and there are a lot of shared themes, which can be good and bad. It's good because it somewhat simplifies antifungal treatment, but it's bad because the symptoms are often non-specific and can be hard to differentiate from bacterial and mycobacterial infections, and even harder to differentiate one fungal infection from another. A common theme for fungi is that they can cause profound disease in the immunocompromised, and really much less interesting diseases in the immunocompetent. So more likely than not, questions about fungi will be about a patient who is immunocompromised. The first group of fungi we'll cover are systemic fungi, which means they can spread to other parts of the body besides the lung. You'll notice that they have a lot of similar characteristics, which we'll repeat in every video so that it really sinks in. But you should pay special attention to the geographical distribution of these systemic fungi. This information will almost certainly be included in question stems for systemic fungi, and will really help you narrow down your differential. You'll see what I'm talking about in the next few videos. For now, let's get started with Histoplasma capsulatum, which causes histoplasmosis. When you hear histo, think historian, because we're drawing a scene about a historian exploring a cave. He's basically Indiana Jones's super nerdy stepbrother. Ooh, and histo is actually prevalent in Indiana for Indiana Jones. But I'm getting ahead of myself. We'll get into that in a little bit. That was just a little stream of consciousness mnemonicizing there for you. Anyway, on exams, histoplasma will almost always be associated with bird or bat droppings. However, examiners may not be that nice, and instead of telling you that someone was around bat droppings, they'll more likely mention someone who has been recently inside of a cave, like a spelunker, or someone who's had exposure to chicken coops, like a farmer. So our scene is going to take place in a cave filled with bats. Again, with all of our systemic fungi, it's very important to learn its geographical distribution, because they'll all cause very similar symptomatology. For example, histoplasma is endemic to the Midwestern and Central United States, along the Mississippi and Ohio River valleys. And what do you know? This is exactly what is on the map that the historian is looking at. On practice tests, if they mention a state or a specific region of a country, just get in the habit of saying to yourself, okay, the test writer is telling me to consider fungal infection. If you do this and can focus on buzzwords such as caves or farms, you'll be just fine. Now you'll notice the historian is coughing. Well, this is because transmission of histoplasma and the rest of our systemic fungi is through the respiratory system. Usually spores in bird and bat droppings are inhaled, and those go to the lungs. Then they get ingested by macrophages. And this is one way to diagnose histoplasma, seeing a macrophage filled with small intracellular oval bodies. So we're going to draw a recurring symbol for macrophage, the macrophage cage. And inside the cage, we're going to draw a canary. You know the story of how miners would take canaries down the mines with them and use them to see if the air is safe to breathe. If the canary dies, then it's time to turn back. Well, we're in a cave filled with histoplasma, and the historian has brought his canary along. So this is one way to diagnose histoplasma, by seeing the macrophage from a tissue sample or respiratory specimen and staining it with a KOH prep. Diagnosis of any fungi can also be done through a culture. However, this often takes a lot of time, so it's rather inconvenient. A better way is through a rapid histoplasma urine or serum antigen test. To represent both of these concepts, we're going to have two stalactites from the ceiling of the cave dripping down. One is red, which is meant to be serum, and the other is yellow, which is meant to be urine. So these are the two ways you can do a rapid antigen test. To see what macrophages would look like in a tissue sample, look at the puddles, and you'll see several ovoid bodies. And again, these symbolize what the histology of a macrophage filled with histoplasma would look like. And one feature that you may get tested about is the size of comparison to an RBC. Histoplasma is much smaller than a red blood cell, and this is easy to remember since you see several of these histoplasmas inside of one macrophage, and one macrophage is only slightly larger than a red blood cell. So they have to be really small to fit in there. Okay, the next thing you need to know is that histoplasma is dimorphic, which means the form of the fungus depends on the temperature of its surroundings. And this is a feature that is shared amongst all of the systemic fungi. To help you remember which form of the fungus occurs at a given temperature, you may have heard the phrase mold in the cold and yeast in the heat. This means that in the cold, or the soil, the fungus is in mold form. In the heat, or in the body, which is around 37 degrees Celsius, the fungus assumes a yeast form. Now, our recurring symbol for dimorphism is going to be a butterfly, which makes sense, right? Caterpillar is one form, and then it undergoes metamorphosis and becomes a butterfly. So let's draw our dimorphic butterfly here to represent histoplasma's dimorphism. Now we'll move on to clinical presentation. In general, the systemic fungi are asymptomatic or subclinical in most people. However, they can cause granuloma formation and thus cause a pneumonia in those unlucky few. You'll notice the historian is coughing to represent this pneumonia. You should also know that lungs develop granulomas that eventually calcify, leading to chronic pulmonary issues. In fact, chronic histoplasma can look a lot like TB, with cavitary lesions in the upper lobes and calcified nodules with fibrotic scarring. To demonstrate this, look in the back of the cave. Do you notice how the cracks in the walls of the cave kind of make the walls look like a pair of lungs? You have the right lung here, seen on the left, with 3 lobes, and the left lung is seen with 2 lobes. And to symbolize the calcifications, we have many stalactites growing throughout both of the lungs, especially in the hilar regions. To remind you that chronic histo can resemble TB, we're even going to draw in another book that has the cactus of TB's Wild West scene. Besides the pneumonia, histoplasma can also cause erythema nodosum. These are painful red nodules, usually found on the shins. To symbolize this, we have 2 cave pillars drawn here that look a little pale. They're meant to look like long legs, and maybe they're wearing Saturday Night Fever bell-bottoms. And we'll demonstrate erythema nodosum on them by adding red dots speckled all over the front. Now it looks like this yellow stalactite is in an unfortunate location. Or rather, it's kind of a perfect location. I actually really think that it was an accident. But it'll help you remember that these pillars are legs covered by erythema nodosum, and that yellow stalactite is supposed to represent urine antigen testing. Alright, I'd mentioned that the systemic fungi are especially associated with the immunocompromised. So what happens when an immunocompromised person gets histo? We're going to add an ancient cave drawing of a bull, and we'll give him some spots that represent the liver and the spleen. And this is because dissemination of the fungus to the liver and spleen will show up clinically as hepatosplenomegaly, and the gross pathology will show calcifications in the liver and spleen. And why these organs? Well, the fungus targets the reticuloendothelial system, which has a lot of macrophages, and these are prevalent in the liver and spleen. Along with hepatosplenomegaly, patients may develop other skin and neuro findings, but we think hepatosplenomegaly is a unique feature that you should remember. To remind you that this is the disseminated form that most commonly occurs in the immunocompromised, we're going to draw in the historian's cane near the bull drawing. And this cane will reappear in all of our systemic fungi sketches as being the symbol for being in a weakened or immunocompromised state. Alright, to finish up, let's talk about treatment. In general, our systemic fungi could cause either a local infection or progress to a systemic infection. Treatment is dependent on the status of the infection. For local and mild infections, we'll use azole drugs, like fluconazole and ketoconazole. We'll symbolize these as pine cones. Get it? Pine cones for fluconazole and ketoconazole. Don't worry about which one you choose for which fungus, just know about the azole class and that they're used for all of the systemic fungi. For systemic infections, we need to use something much stronger, specifically amphotericin B. Amphotericin is a nasty drug with a lot of side effects, which is why it's reserved only for potentially life-threatening systemic infections. We'll help you remember amphotericin with our amphotericin amphibians, specifically a frog, which we've drawn on the rock. Notice that the frog is strategically placed underneath the cane, and this is to drive home the point that you only need this potent drug if the fungus disseminates, which generally happens in the immunocompromised. Alright, that's a lot of info for our first video, but now the rest of the systemic fungi videos should be a bit shorter, because there are a lot of similarities between them, so we won't need to go into as much detail as we did here.